Of course, like anything, more rigorous research is needed to show that self-compassion training is really appropriate and effective. And we don't know if there's any adverse side effects. It seems like there wouldn't be, but there is some interesting things that I've read over the years. Just in writing my chapter, I really came across some interesting, they're not really adverse effects, but just fears, blocks, and resistances. So some fears that we can have to compassion, and I'll be talking about that in a moment. Okay, so self-compassion in the healthcare provider. So this is the last orientation. So this is the benefits here. It can really be some of what we talked about, like in the general population just a few slides ago. So the improved health outcomes, the physical, psychological, emotional well-being, emotional resiliency, but increased concern for others. So we don't have the research that shows if we practice cultivating compassion for others, that it translates and we're more compassionate to ourselves. We don't have that yet, which I think is interesting. But we do have, it shows that if we can cultivate self-compassion, that it seems to translate that we might be a little bit kinder to others. So I think that's interesting. And of course, concern for others, that's something that we would want, we're interested in our profession. And of course, again, the reduced burnout and empathic distress fatigue. So the compassion, it's a good thing, right? Do you agree? If you have any questions after, though, please still feel free to challenge me on that. But it seems like it's a good thing, yet we do have fears, blocks, and resistances to compassion. So I find this fascinating because I think I'm a pretty decent human being. I try to be kind, but I have times when I am not. And I'm sure we can all admit in here there are times when we didn't act as kind as we wanted to. Why is that? Like why? And there are some things. And there's, by the way, there's an entire chapter in that Oxford Handbook of Compassion Science on fears, blocks, and resistances. So again, if you're inspired and you find it fascinating, pick up that book. Okay, so one block may be unmanaged personal distress. Maxie already talked about this. This is our own system. If we are dysregulated, if we are in a state of dysregulation, we are not, or neurophysiologically, we are not in that capacity to give, to offer. It's just the way we're wired. Does that make sense? So there are things that we can do to regulate ourselves, and therefore that may help us prime for compassion. Also, we may be overwhelmed by the stories that the people are telling us. And the research shows, this isn't in healthcare setting in particular, but it shows that we're more likely to be compassionate and provide a compassionate response if there's like one person. And then as the numbers go up, the compassion goes down. So, we can kind of translate that. It's conjecture, but we can translate that to the problems that we're hearing. We may feel like we can't do it, we can't help. And then we shut down, again, going into that dorsal vagal neural platform where we go into shutdown because we can't do it. And then we may have the belief that compassion might be unhelpful for this person. That could be based on our beliefs, our belief system. Remember how I talked about the motivation and versus the self-criticism? So maybe we believe inherently that compassion is this soft skill, and it's not going to be the best for that person. They need the iron fist, they need the kick, they need the, and maybe we feel that in order for us to best help them, we want to have them, that the self-compassion might get them, too dependent on us and all that. So beliefs can be there.